Hey folks, this is Liam with Compliancy Group. I'm one of our senior account managers here. Going to be doing the webinar for us today. Thank you to those of you who are already on or joined a little bit early. We're going to give everybody a quick minute here before we get underway, just to make sure we can get either dialed in, get audio set up, that everybody's able to get settled. A couple of housekeeping items before we actually get into the content of today's webinar. One thing we always want to keep in mind and be cognizant of, I know that many of you either might not be able to sit in for this entire thing, you have other appointments, other priorities. All of our webinars are recorded. So if you would like a recording of this webinar, you can actually access it right through our website. You can go to compliancygroup.com, check out our resources page, all of our webinars, the archive, it's all there. We will also send an email following the webinar today with a copy of the recording and copies of the slides for your records. All of that is going to be readily available. One other housekeeping item, always we want your questions as we go through the webinar. So if there's anything that we're discussing today that is confusing or that you want more clarification on, or you have kind of a unique situation and you want you want us to help you address it a little bit more specifically, please go ahead and shoot a question. There's a Q&A feature right inside of the GoToMeeting. You can ask your questions right through there, and we'll make sure that we set aside plenty of time at the end of the webinar today to address any of those questions or concerns that you might have, to make sure everything is being covered. If we're not able to get to those questions within the time that we have today, either myself or somebody on our team will follow up with you and make sure that all of that is addressed. Now, with housekeeping items out of the way, what we're going to be talking about today specifically is completing your 2020 risk assessment. Okay, and before we go any further, I do have a quick poll that we're going to send through. And what we're referring to, so specifically the term that the government uses as it concerns HIPAA is risk analysis. Okay? It's the comprehensive assessment that's required to be done once per year for your HIPAA compliance. We want to just, before we actually get into the content today, we'd like to get an idea as far as who has actually completed the risk analysis for this year and who hasn't. If you have not yet done it this year, we would say don't feel bad. This has been a crazy, insane year for most at best, or a potentially extremely difficult year for many at worst. So feel free to just answer that question. We just want to get a gauge on overall what we're looking at here. Looks like we've got the majority of the results in. I'm going to give it just another 15 seconds before I close out the poll, and then we'll go over some of the results prior to getting into the content here. Alrighty, any last second answers coming in? Closing out the poll now. Alrighty, so interesting. So if we look at the results here, and I'll just share this really quick before we get into the content. About 27% of you said that you have completed your risk analysis for this year. That is fantastic, okay? The risk analysis, really as HIPAA defines it, it's going to be the most foundational component of your compliance programs, because it's what then informs you on what you need to be doing in every other area. So that's a very good indicator to us of somebody who is moving down the right path from a compliance perspective. Those of you who haven't, or who are unsure, or even if you have done it this year, I think this webinar will be extremely beneficial, because it's both going to educate you on what you need to be looking out for as it concerns your risk assessment, what that risk assessment actually needs to include. And what we're all about is simplicity. Okay, so even for those of you who have done your risk assessment, if you're facing this down year over year and it's just been a royal pain and you don't like the way that you've been doing it, it's extremely complicated and cumbersome getting all that documentation together, hopefully we can give some additional insights today as well, just to make your life a little bit easier. So to get into the actual content of today, and let me just make sure my screen is being shared. Yep, it should be good. I wanted to start by just quickly introducing our company, Compliancy Group, to give a little bit of a backdrop, really just for the sake of saying that you are in very good hands. So our company, we were founded in 2005. So we've been in business for over 15 years now. We have clients in 34 different countries, all 50 states, well over 400,000 users of our service at this point in time. And in the history of our company, we have never had a single client fail any type of a HIPAA audit, investigation, or be fined. And that's OCR audits, CMS audits, State Attorney General audits, across the board, never had a single client fail. And I only mention that because at the end of the day, you don't have to be a client of Compliancy Group, but we want you to know that what we're going to be speaking about today and the things that we're talking about come from a position of what is significant subject matter expertise and a very lengthy history of getting this right for what is often an extremely misunderstood regulation. And what's most important, at least to us, when we're talking about compliance-related topics, is understanding the ways that not only HIPAA can be important from a security perspective. Of course, you don't want to get fined, you don't want to be audited, you don't want to have breaches, but understanding the ways that HIPAA and taking these things seriously, implementing a compliance program actually has an innate benefit for your practice, even in the way that you're able to satisfy your patients and your clients. Because if we boil all of this down, okay, you might be thinking of HIPAA compliance from a training perspective, from a policy perspective, from a security perspective, whatever it is, all of that, yes, comes into play. But what HIPAA looks like, at least in terms of what you need to be doing and documenting on an annual basis, is a very specific process where you conduct a comprehensive assessment to identify any potential gaps or risks that you might be facing to your patient's information, and then addressing those risks. The interesting thing is that if you are doing that and doing it properly, you're going to then become compliant in all of those other areas because the assessment required for HIPAA is going to cover your technology. There are administrative assessments that are going to address your processes, policies, procedures, and even physical audits to make sure that in your physical location, things are kept secure and compliant. What ultimately happens as a result of that is that if you go through that process of assessing your risks and addressing them fully and properly, you have now standardized your operation. Okay, you've put yourself in a position where, whether it's from a technology perspective or from a policy perspective, all of your employees are now reading from the same playbook. Okay, meaning that when patients come into your practice, okay, or when clients call your company, what's happening now is they're receiving a much more standardized experience. Okay, meaning better patient care, better service, increased loyalty, whether that's for patients or customers, depending on the category that you fall into, and ultimately increased profit. Okay, a really cool statistic is that practices and companies in general that are compliant and secure are on average 15% more profitable than ones that are not, because it has an operational impact across all aspects of your business when this is being done properly. So we say this because a lot of people come at HIPAA from the perspective of, oh my goodness, this is something I have to get done. They dread doing it every year. They hate talking about compliance. They hate talking about their risk assessments and their policies. But if you look at it from a different angle, there's some tremendous benefits, okay? And we as a company practice what we preach and take this very seriously, even in our own internal business. And oddly enough, we're currently listed among Inc. 5000's not only best places to work, but fastest growing companies in the nation. And we have accomplished that by applying exactly the things that we teach our clients to apply as well. Now, some of you might be thinking, before we actually talk about conducting your own risk assessments and your own audits, you might be thinking, what is actually the risk that I face of having a HIPAA issue or having a HIPAA audit? And you'll see some random odds listed here, okay? So winning the lottery, you've got a chance of about 1 in 175 million, okay? So, but many of you have still probably played the lottery, right? Being attacked by the shark, 1 in 11.5 million. Hit by lightning, 1 in 960,000. Hole in one, 1 in 12,000. To be randomly audited by the OCR for a HIPAA issue, about 1 in 1,000, so still pretty slim odds. And for a CMS audit, it's 1 in 10. Now, you might be looking at that random HIPAA audit statistic and thinking, okay, 1 in 1,000, that's really not that bad. I don't really, my chances of being audited are slim to none. Now, the difference is that random audits comprise a very small percentage of the investigations that the government conducts every year, because the number of cases that we handle, okay, and the majority of the investigations that the government conducts don't come just from them randomly auditing you. It usually happens as a result of a patient complaint or an employee whistleblower, okay? How many of you have ever had to fire an employee that was unhappy, okay, and it created some difficult circumstances for you? How many of you have ever had a disgruntled patient that was either not happy with the treatment that they received, or maybe you just sent an email to the wrong person, sent a billing statement to the wrong patient, right? Whatever it is, that is all that it takes for somebody to pick up the phone sometimes, place a complaint with HHS, which then has you on the radar of the OCR. Okay, they receive tens of thousands of these complaints on an annual basis, and they're actually required to investigate every single one of them. It's the #1 way that we see any clients of ours, but in the industry in general, getting on the radar of the OCR. Now, why are we talking about risk assessments and why is that so important? Well, the process of a government audit usually is 3 stages. There is a desk audit, okay, an on-site audit, and then you get your corrective action plan, find the results, fines, settlements, whatever it is. You'll notice that before you even are formally audited, okay, by like an on-site audit where they do a full review of your compliance programs, they will do what's called a desk audit, where they ask for documentation showing your gap analysis and your remediation reports, okay? What that is specific documentation and reporting showing the gaps that you found in your risk assessment and remediation plans that you put in place in conjunction with that risk assessment to get all of your gaps filled in. If that documentation is totally as it should be, there is absolutely no reason for you to be accelerated to this next phase of a government audit. They would have no reason to conduct an on-site audit if you have accurate documentation for your gap analysis and your remediation reports, which you would always have if you were doing your risk assessment on an annual basis. This is why it is so important, okay? You can save yourself a whole ton of wasted time, wasted money, and just a real pain of going through the process of a government audit, fines, settlements, whatever it looks like, just by having your risk assessment in order on an annual basis. So what does the rest of this look like, okay? The reason why the risk assessment is so important is the government, if you look at their documentation around risk analysis, it's considered to be the most foundational aspect of what they call an effective compliance program, okay? And really an effective compliance program, as the government looks at it, it's just a very specific set of annual requirements that must be abided by and documented within your practice on an annual basis. That risk assessment informs what you're going to be doing in all of these other areas, okay? So you'll find policies and procedures, okay, is a big part of it. 3 of the required audits for your risk assessment for HIPAA are all about your policies, okay? Things like designating a person to ensure they are followed, conducting effective training and education, lines of communication, internal monitoring and auditing, how you're enforcing these standards, how you respond, okay? It is all, believe it or not, it is all a part of that risk assessment process, okay? And the funny thing with this is that all of these elements that the government talks about what constitutes an effective compliance program, sorry about that, it's actually used by some of the biggest brands in the United States to grow their brand loyalty. So you have a company like Starbucks that has become so prominent and so successful because they have figured out a way to successfully implement across their entire company, okay, specific policies, making sure that somebody at each of the locations are ensuring that they're followed, training their staff, developing lines of communication, monitoring this effectively, and then enforcing those standards when necessary. What that means practically is that I can fly to Los Angeles and order a latte, and then fly back to New York and order that same cup of coffee, and I'm going to receive a remarkably similar level of customer service. Okay, but I'm also, my cup of coffee is probably also going to taste exactly the same. Okay, that is really what compliance is all about. And that's why when we talk about the benefits of doing this right, it's really just a way for you to grow your brand and improve your patient experience, consistency, standardization across all levels. The problem is that HIPAA is one of the most widely misunderstood regulations that there is, okay? Because there's a lot that gets thrown into the mix here. Okay? You have misunderstandings as it relates security. Many people believe that because they're working with an IT company and they have their technology set up properly, that they're therefore secure. Many people get this mixed up with the high-tech requirements for accelerated adoption of their EHR, things like MACRA MIPS and meaningful use. You then have the omnibus rule, which was an attachment onto HIPAA. Tons of different things here. Okay, what we're really going to try to do right now is just clear the air, talk about what exactly has to be covered in the context of your risk assessment, okay, and how to go about doing. Okay, there's lots of different ways that you can approach this. First and foremost, what actually has to be included in your annual risk assessment for HIPAA compliance? You'll see here the risk analysis for HIPAA breaks down into 3 different areas. Okay, technical, physical, and administrative. Okay, the technical is obviously going to be more related to your IT security. Physical site audit, self-explanatory, that's your physical security, and then a series of administrative audits. Okay, for your security policies, your privacy policies, things like your high-tech subtitle D actually relates directly to your breach notification policies and how you respond in the event of an incident or a breach occurring. One thing that you might find interesting is that overwhelmingly, 3 of the required 6 total audits for your HIPAA compliance are administrative in nature. Meaning, if you've been working with an IT company and they've been doing a technical audit with you every year, that is not going to satisfy the extent of the requirements for your HIPAA risk analysis. It has to include these administrative assessments, and I'll explain why, okay? You probably, in the grand scheme of things, what most patients are hearing about from the perspective of the healthcare industry, just a whole lot of bad news, okay, about breaches happening, fines being levied, doctors being corrupt, okay? Even almost 90%, 89% of healthcare organizations have experienced the breach over the last 2 years, okay? The reason why the government takes those administrative audits so seriously is because 86% of the breaches that happen in the United States are administrative in nature. Meaning it's not usually an IT problem. It's not failing technology. It is most often failing people, okay? An employee or somebody who fails to properly follow a policy or a procedure that would typically be outlined in your HIPAA policies and procedures or in your manual, okay? Somebody that sent an email, somebody that clicked on a link in a suspicious phishing scam, or allowed malware in, or allowed a hacker to get in, okay, a ransomware attack. The majority of the time, it's a human error issue, okay, which means if that is not being addressed in your risk assessment, you are neglecting 86% of the potential risk that is facing your practice right now. And even if we look at the HIPAA rules itself, you have the privacy rule, which is, of course, the standards for when PHI, or simply patient information, can be used and disclosed. You have the omnibus rule, which is going to be dealing with breach notification, your business associate agreements, your vendor assessment. But then most people get really tripped up when it comes to the security rule, and this is where this misunderstanding comes in, is that they think of it as a predominantly technical component, okay? So they might be doing their security or their technical audits, okay, neglecting these other 3 or 4 required audits for HIPAA, and in so doing, they're only accomplishing and addressing what might be 1/3 of one of the HIPAA rules, okay? We have to have the full picture here in order for this to be deemed effective from the perspective of the government. And a really good case study for this is an organization by the name of the Alaskan Behavioral Health Group. So we're going to kind of run through a couple of things there as far as what went wrong in this particular circumstance and how you can avoid the same mistakes. So the Alaskan Behavioral Health Group had a small breach. Okay, they were a small rural company in Alaska, behavioral health. They had a malware attack that compromised a few hundred patients. Okay, not a huge deal. All of the patients were notified. They reported it to the government. The government did, of course, conduct an audit. Okay, and again, talking about their risk assessments, they asked them to submit copies of their assessments, their gap analysis, and their remediation summary report. What they were able to provide was actually 6 years worth of records of having done a security risk assessment. The problem is that that SRA only addressed the technical components of the required audit for HIPAA, okay? Meaning that they were missing approximately 2/3 of the rest of that required assessment, okay? That was a $50,000 fine to begin with on this organization. This then transposed into an on-site audit where it was a more comprehensive overview of their compliance programs as a whole, including a review of their policies and procedures. As you may know, HIPAA requires that you have very specific policies and procedures in place relevant to the HIPAA privacy, security, and breach notification rules. Well, Alaskan Behavioral Health had pretty extensive policies and procedures. The problem is that they were found to be ineffective because in reviewing these, the government identified that what they had was more like a store-bought HIPAA manual. It had not been updated on an annual basis, or they could not prove that it had been updated. They could not prove that they had reviewed it with the staff on an annual basis, and it hadn't been customized to accurately reflect their own uniquenesses or their own gaps that would have been identified in that assessment. This was another $50,000 fine. And then things like even employee training, okay, which again is going to be a part of your risk analysis from an administrative perspective. The interesting thing here is that they had a very, very reputable third-party training company that would come on site, train everybody in the organization once per year, and then they come out again next year to renew that training. The problem is that they had a 30% turnover amongst their staff, which meant that approximately 30% of their newest employees, the ones that would have needed that training the most, could have been waiting as much as a year before they actually received it. To the government, that was deemed tremendously ineffective, okay? This was another $50,000 fine. So what we are looking at in this particular situation is a total of $150,000 in fines for an organization that really was doing a lot of the things that they were supposed to be doing, but it started with one small problem, and that was their risk assessment, okay? They had only done their security audits, which meant that their remediation plans and their gap analysis was insufficient, leading to a more in-depth review of their compliance programs, which exposed that they were missing all of these other necessary elements of their compliance programs, whereas if they had done all 6 required audits, their gap analysis and remediation plans would have been complete. They would have been updating and reviewing their policies and procedures on an annual basis, customizing them as a part of that assessment process, training the staff, making sure that those policies were attested to, addressing their business associate agreements and their vendor management issues, along with incident management for the breach notification rule, making sure that everything was addressed there. It started with an issue with their risk analysis, and it trickled down to all of these other areas, okay? This has to be done once per year, and it has to be done properly, okay? And this is not me saying this. This is a government statistical data, okay, about ways that your compliance programs could go wrong. Because you might be thinking, as you look at this, that you're doing all of these things, okay? And part of the trouble is that, yes, many of the people that get audited by the government for a HIPAA issue are doing these things in practice, but to the government, not necessarily relevant what you're doing in practice. What matters is what you can prove on paper, okay? And something like your risk assessment helps you accomplish that through everything else. And at the end of the day, it's really just good for business. Like we said, of course, HIPAA compliance is legally required, but what it really represents is a cool marketing opportunity for your practice, where if you're taking compliance seriously, you're taking the security of your patients seriously, it puts you in a position where you can stay ahead of the curve. 63% of patients would say that they are not confident that their healthcare provider is protecting their medical records the way that they're supposed to, okay? Imagine what would happen in your practice if you could not only take these things seriously, but then figure out a way to clearly communicate that to your patients through your website, through social media, through the second that they walk in the door, giving them the confidence that you take their data privacy and security seriously, okay? It would go a long way in building trust, differentiating yourself from your peers and competitors, and just give your patients an overall better experience. It's just a big differentiator, and it allows you to go the extra mile while also protecting your practice and satisfying these expectations. So as a quick recap for some of the things that we discussed today. From a administrative perspective, okay, you have to be making sure that you're doing your risk assessment annually, okay, that you're training your staff, that you've implemented policies and procedures. That's going to prevent a lot of breaches from happening in the first place. From a technical perspective, which is also, you're going to want to make sure that this is covered in your risk assessment, is things like encryption, backup, you have a disaster plan. So when something goes wrong, you're able to address it quickly and efficiently, okay? And all of that begins with conducting your risk analysis properly. So what we want to do, this concludes the primary content portion of the webinar today. I hope this was helpful, at least in pointing you in the right direction as far as what you need to be looking at as far as your risk assessment goes on an annual basis. What we're going to do now is go through some of the questions that we received. I will do my best to answer every question that we get right here on the webinar so that we can make sure everything is addressed properly. If there's things that are popping into your head, please feel free to submit it now. I'm going to go ahead and get those questions open so that we can second this covered. Okay, so first question. If a CEO of a nonprofit, i.e. a community health center, is not interested in creating an effective compliance program, there is really no way to move forward, is there? BOD follows the discretion of the CEO, and the compliance officer is there to satisfy the requirement only. So this certainly puts you in a difficult position, whoever has asked this question. I'll say, if you don't have executive buy-in for implementing these things, it can certainly be an uphill battle and not the easiest thing to accomplish. What I would say, we do a webinar every year on all of the HIPAA fines that are levied, okay? I would take a listen to that. If you check out our webinar archive, you can listen to the one that we did last year. Send it to your CEO, send it to your board of directors, okay? Have just a very frank conversation about the risks that the organization faces and what you're looking at. But unfortunately, yeah, you know, unfortunately, if that's the position that you're in and you're not able to get that type of executive buy-in, I would be happy to help. You can reach out to me. I would love to have a conversation and love to see if we could even get on the phone to try to help move this along for you. It would truly be my pleasure. But yes, it does put you in a little bit of a difficult position. So I can definitely feel you there. Okay, so when you talk about doing your risk assessments on what? Applications, DR, etc. Yeah, so again, that 6-part assessment is going to cover a lot of things. So first, the 2 technical audits, right, which is your asset and device audit. That's going to be a comprehensive log of any devices that you have inside of the practice that could potentially access patient data. So computers, phones, flash drives, even printers, whatever it is, okay, has to be included in that asset device audit with an explanation of how it's being protected. You then have the IT risk analysis in and of itself, which is going to be a bit more of an in-depth overview as far as your network, your Wi-Fi, your security, your firewall from a higher level perspective as far as what you currently have in place. You then have your physical site audit, okay, which is going to relate directly to your physical security, locks on doors, file cabinets, even access to workstations, things of that nature. And then those administrative audits, which is going to be more policy, procedure, administrative oriented. Okay, is what has to be covered. Okay, we actually don't have any other questions, which is shocking. So I would say anybody who's on this webinar right now, if you have a question and you'd like me to answer it before we close out the purposes of today, we'll give you another minute or two. I, again, would be happy to answer it. You'll see my contact information here on the screen, my email, my phone number. You can feel free to give me a call, shoot me an email. I would be more than happy to address any questions or concerns that you might have. And what I would also say is that if you are looking for a way to get this done and get it done properly, this is exactly what our company does. Okay, so our software platform is kind of like the idea of having QuickBooks, but for compliance, so that you can streamline that risk assessment process and put you in a position where you're able to get all these things done. We're actually offering 3 months of service free for anybody who is on the webinar today. So if you'd like more information, again, please feel free to reach out to us. We'd be happy. We would certainly be able to get your 2020 risk assessment done before the end of the year, without a doubt. So if you're in a bind and you're looking to get this done quickly, please reach out to us. It's designed for a small practice. We make it as affordable as we can. One more question. Okay. Will there be dashboards included? Yeah, so in our platform, you would have an actual dashboard where you can see all open gaps, tasks, remediation plans, and any incidences, so that you can manage all of that from a centralized location. And then training, so there's another question regarding how training is conducted in our platform. We actually have an employee training tool built right into the software. So it's called the Guard. Okay, so it's not only where we'll conduct your risk assessment with you, we'll set up your policies right inside of the tool, and then employees will have a login where they can access the Guard's training platform, conduct all their required trainings, and attest to their policies and procedures right inside of the platform. So we would even be happy to demo that with you for whoever's asking that question. Should the risk assessment be available for everyone to see at the organization, or just be available for when needed? So certainly shouldn't be available for everybody to see in the organization. Really only the people, like let's say your IT administrator, whoever's the compliance officer, really only the person that is primarily responsible for these things should have total access to that risk assessment, because it's not intended to be public knowledge, and you want to have it on file as well, just in the event of a government audit. It's not necessarily the worst thing ever if everybody has access to it, but it would just not be necessary. And another question regarding the service, is the training per module, or once you sign up, you have access to all? Yeah, so it's just a flat subscription service. Once you sign up, you have access to everything that we offer: risk assessment, training, policies, the whole shebang. And then one more question. If I need help with policies and procedures that are specific to organization, but do not need a risk assessment, can your company help with this? Yeah, so we could certainly speak about it. I would encourage you to request some information. One of our account managers could have a conversation with you, because you might find, even if your risk assessment has been done for this year, it's still something that you might need to do for next year. And then we can actually integrate that with your policies as part of that whole process so that everything is documented in one place for you. Might just simplify your life a little bit on that front. Then. And one more question, will the account manager be available throughout the whole year? Yes, so we have account managers that can assist in bringing you on board with the platform. But what you would actually have to help you get started with the Guard is a dedicated coach on our end that would meet with you and actually work with you until you are fully set up with the product. Okay, so fully completed your risk assessment, policy set up, trainings implemented, they'll even help with your BAAs, everything. What usually happens is the new client of ours might have 3 or 4 meetings with that coach, okay, to get started, and where you'd then be fully implemented and in a position where you're fully compliant as well. But that support is then totally available to you all throughout the year, so you never lose that. All righty, so certainly appreciate everybody's time. If there's any additional questions, please, again, feel free to shoot me an email. If there's anything that I missed or that we didn't get to, either myself or somebody in our teams will follow up with you. We would be more than happy to address. So if anybody needs anything, again, my information is there. You can request information from us directly on our website, or you're going to get a little survey after this webinar. And so if you'd like somebody to follow up with you, just answer those questions and we'll have somebody reach out, okay? We certainly appreciate everybody's time today. We hope it was at least helpful and informative and pointing you in the right direction. And if you need anything, you just let us know. Hope you all have a great day. Thanks for attending.